know that you're an advocate for women in leadership and diversity. We talked about this the last time we were on the phone. Why do you think diversity is so important to promote? And I think the follow-on question for me on this is going to be, what's some advice that you would give women in healthcare IT at this point? So why do you think diversity is important, and advice for women in health IT?
So I think, diversity is important. We need to have different opinions at the table in order to solve really complex problems. And as you know, in healthcare, and specifically in IT, we've got a lot of complex problems to solve. I also think that, at the leadership level, we need to have representation of our patient population. And when you think about it, 60% and above of healthcare decisions are made by women. And so that's why I feel, pretty passionately that, the leadership has to reflect, our patient population and where the decisions are being made in order to engage our patients also. And, I'm very lucky to be working at an organization where, we have great examples of strong executive women. We had a number of them recognized recently in Cranes. And, we're also the #1 health system, according to Diversity Inc., for diversity and inclusion. And we've got a great diversity and inclusion program here. So again, an honor to work at Mount Sinai.
Yeah, and well, that would have to be the case in New York City. It is literally the epicenter of a melting pot. Your patient community is very diverse, and your care community is. Is there anything any advice you would give to women? I saw a post, I think it was a LinkedIn post, where a health system team said, just finished our strategy session, setting our strategy, whatever, great meeting. And the picture had a picture of all the people that were attending. And I kid you not, I think it was like 14 men and 2 women. And I thought, that's problematic.
Yeah.
But what's your advice to women to get more women in that executive level, seat at the table talking about strategy? How are we going to do that?
Well, I think, ultimately it starts with the recruiting and the pipeline. And, if you are an executive, it doesn't matter what gender you are, and you're receiving the same resumes over and over, the question is why? And so you've got to go back to HR, and you've got to look at, the pool of resources that you're trying to pull from. And that's not just for gender, it's also for underrepresented minorities. And, so I think that that's where it starts. I would also encourage, female leaders to engage the men in their department as allies, because just having a discussion with other female leaders is great. And I think that, it helps other women in the department, but ultimately we have to engage the men in this endeavor. So if there is, a room full of men, I think that, the question would be, where are the women? And I think that, women leaders and men leaders need to bring in other women into the meetings, even if they're, directors or senior directors, just to give them that exposure, give them the seat at the table and hear what their opinions are. And I think if more and more happens like that, we'll get some progress. And I also think mentoring is huge.
Yeah.
I know that, sometimes it's a challenge for women. I've heard many, many women say they've not been mentored by a female leader. So I really encourage mentoring at our health system. And, we've got a great program here. But I would encourage, other health systems and hospitals to have a mentoring program and have women-to-women mentoring. It helps.
Yeah, be a mentor, seek a mentor, and I think that's a great way to end the show.